Hi everyone, it's Nurse Dani. Each week I answer your questions with either a written or video response, and here's answers to some of the questions you asked during the week. When couples are trying to have a baby, they want to know what they can do to increase their chances of conceiving, and it all comes down to timing. You have to time intercourse with ovulation or your fertile window, and a woman is able to conceive for 6 days out of each cycle, 5 days leading up to ovulation, and on the day of ovulation. So in order to calculate your fertile window, you need to know how long your average cycle is. And let's say that's 28 days. You're probably ovulating around day 14. And if you count backwards from that, day 14's ovulation, 13, 12, 11, 10, and 9. That's your fertile window, days 9 through 14. You want to have intercourse during that time at the most once a day, and that will increase your chances of being able to get pregnant. A good rule of thumb if you're trying to conceive is just starting to have intercourse every other day, starting on the day your period ends, and that should time things just right. Keep in mind that it can take up to 6 months on average to get pregnant, so if you've been trying for a few months, don't get discouraged yet because that's normal. Even on your most fertile day, if you time intercourse just right, your chances of pregnancy are only 30%, not 100%. So hang in there, keep trying, and then if a year has gone by without success, then it's time to talk with a doctor about infertility treatments. You have a 5-month-old little girl with eczema and you're wondering what might have caused it. Is it something that just happens or is it associated with allergies? And actually the answer to both of those is yes. So eczema can run in families. It can be genetic. If you or your husband or other people in your family have it, then that's definitely a possibility. But it can also be triggered by allergies. The most likely triggers are pets, food, dust mites, pollen, hay fever, asthma. Those conditions can also be associated with eczema. Eczema is actually the most common skin condition treated by pediatric dermatologists. And in fact, 60% of children who have it are diagnosed before the age of 1. 90% are diagnosed by the age of 5. And infants who had it usually have it resolved by the time they're 4 years of age. So it's very possible that as your baby girl gets older, it might resolve on its own. Sometimes it does persist into adulthood. There are a few things that you can do to try to alleviate the symptoms for her. There are topical treatments, both over-the-counter and prescription, as well as oral treatments. And so I recommend talking with your pediatrician, and they'll be able to give you the best advice about what you can do to help her avoid the itch and prevent flare-ups. You mentioned that you've had some concerns about your 7-week-old's belly button and how it looks. You're wondering if it's normal or not, and I do recommend bringing your observations and concerns to the attention of your pediatrician. And after looking at it themselves and asking you more questions about your baby's behavior, they'll decide if further investigation or treatment is necessary. You want to know when it's safe to switch your almost 4-year-old into a booster seat from a car seat. And this is a good question, one that a lot of parents have. Your child needs to be at least 4 years old and at least 40 pounds, or if your child has outgrown the height requirement specified by the manufacturer of the car seat, or just set your child in the car seat, and if the shoulders are higher than the back slat for the harness, then they're too tall for it and it's time to change them to a booster. Make sure you just don't move your child to a booster for fun because they're safest in a car seat until they're too big for it when it comes to weight and height requirements. Also, make sure you don't skip the booster stage entirely because there are actually some short adults who might benefit from a booster because it's really important for the shoulder strap and the hip strap to be over the hip bones and at the proper point in their chest. That's what a booster does for a child. It raises them up and makes it so that the seatbelt fits them properly. If you were to get in a car accident and the straps weren't fitting properly, then it can actually do serious damage. So again, it's very important to use a booster and not skip that stage. A lot of people are really confused when they talk about pregnancy in months versus weeks. And your OB provider will always refer to your gestational age in weeks because that's how we calculate it. It is really confusing because the gestational period is 40 weeks. But the first 2 weeks of your pregnancy, you're not actually pregnant. So basically, the gestational period is 38 weeks from the time of conception till the 40th week of pregnancy. When you see your doctor for the first time, they'll calculate your due date based on your last menstrual period. And that is actually the first week of your gestational period of the 40 weeks. So that's kind of what makes it confusing. So when you talk about pregnancy in months, basically what a medical professional would think of is how many 4-week periods are there. So if you're 6 months along, then we would consider you to be 24 weeks. But that's confusing to some people because they think pregnancy only lasts for 9 months, when technically speaking, it lasts for 10. So if someone says they're 9 months along, they could just be 36 weeks, or they could be 40. It depends on how they're looking at it. Again, that's why we just eliminate the confusion in medicine and talk about the gestational period in weeks. You mentioned that you got your first Depo shot injection 2 months ago and you've had bleeding lasting 8 days and you're wondering if that's normal or not. And that actually is a normal side effect associated with the Depo shot. It's normal to have unscheduled bleeding or spotting for 7 days or more. And this is actually the most common reason why women don't go back to get more injections or continue using the Depo shot for contraception. With ongoing use, though, one of the largest side effects is the fact that it makes you have no period. So this is a desirable effect, but for some women it takes a few injections to get to that point. Studies have shown that with ongoing use, 75% of women stop having periods entirely. I do recommend talking with your doctor if these bleeding patterns persist and they're bothersome to you. Again, it could be a normal side effect associated with the Depo shot. It's probably not a sign of a problem since you just got your first injection, but after asking you more specific questions, they'll be able to counsel with you about whether this or another type of contraception would be better for you. I hope you found these tips helpful, and if you have more questions in the future ranging from preconception to women's health, be sure to like our Facebook page, like this video, and subscribe to our YouTube channel by clicking on the link above.